Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes of blood in baby's stool. Blood in your baby's poop could be caused by a medical problem like an infection or constipation. It is important to keep in mind, though, that red stools aren't always caused by bleeding. Some medications and red dyes in food and drink can also cause your baby's stool to appear red. /r/n/r/n This article looks at some of the reasons why your baby's stool may look red. It also lets you know when you should take your baby to a healthcare provider for blood in the stool. /r/n/r/n There are a few different conditions that can cause blood in your baby's poop. Most of the time, the cause is benign and the condition will clear up on its own. Some, however, require treatment by a healthcare provider. /r/n/r/n Several different bacterial infections can cause this symptom, including shigellosis, salmonellosis, and campylobacteriosis. /r/n/r/n See a healthcare provider if your baby has symptoms of bacterial gastroenteritis, such as bloody stool, vomiting, fever, and stomach pain. Most of the time, a bacterial infection can be treated at home, but your healthcare provider may want to prescribe antibiotics if your baby is very young, has a weakened immune system, or has diarrhea that persists for more than a few days. /r/n/r/n Bloody stools can also be a complication. Antibiotics. Antibiotics can cause an infection of the intestinal tract called Clostridioides difficile, C. difficile or C. diff. Other symptoms usually include abdominal pain, weight loss, diarrhea, often bloody, fever and decreased appetite. /r/n/r/n The most important treatment for bacterial gastroenteritis is hydration. Make sure your baby is getting plenty of breast milk, water, or an oral rehydration solution formulated for babies such as Pedialyte or Enfalyte. If your baby doesn't seem to be able to keep fluids down or seems unusually lethargic, contact your healthcare provider. /r/n/r/n A child with constipation can have large, hard stools that are difficult to pass. Passing a hard stool can cause an anal fissure or tear in the anus, which can lead to blood in the stool. /r/n/r/n Symptoms of constipation in babies include infrequent stools and pain or crying when passing a stool. The stool may look hard and pebbly. /r/n/r/n Allergic colitis is common in infants and is often caused by cow's milk protein. According to some studies, as many as 2% to 3% of babies will develop an allergy to cow's milk. One of the most common symptoms of this condition is blood in the stools. /r/n/r/n A cow's milk allergy can also cause vomiting and fussiness, especially after feeding. Because these symptoms are common to other illnesses, however, the only way to know for sure that your child has a milk protein allergy is to eliminate all dairy from their diet. /r/n/r/n You can reduce your baby's risk of developing a cow's milk allergy by breastfeeding exclusively and avoiding supplementation with cow's milk formula during the first 6 months of life. If your baby does develop a cow's milk allergy, you will need to remove cow's milk from their diet, which may mean giving them a special kind of infant formula. Fortunately, most babies outgrow this type of allergy. /r/n/r/n If you are nursing your baby and have cracked or bleeding nipples, the cause of your baby's bloody stool could be swallowed maternal blood. /r/n/r/n Swallowed blood may look like coffee grounds or it may cause the stool to look dark in color. It may also appear as maroon or blood-colored streaks. Maternal blood is not harmful to the baby and does not need treatment. It should resolve once your nipples have adjusted to breastfeeding. /r/n/r/n This is a condition that causes inflammation and death of intestinal tissue. It is most often seen in premature babies. It is a rare cause of bloody stool in babies who are born after the 37th week of pregnancy or who weigh more than 5.5 pounds. /r/n/r/n necrotizing enterocolitis is considered a medical emergency and requires immediate surgical treatment. Other symptoms of this condition include difficulty feeding and a swollen abdomen. /r/n/r/n certain medications or the things your baby eats or drinks can also cause the stool to appear red. /r/n/r/n if your child is taking the common antibiotic F, cefdinir, they may be experiencing the common side effect of orange, maroon, or red-colored stools. This is thought to happen when cefdinir combines with iron to form a non-digestible substance with a bright red color. It tends to occur in infants who are receiving supplemental iron or drinking an iron-fortified formula. /r/n/r/n Fortunately, the reddish color goes away once your child finishes the course of antibiotics. /r/n/r/n Some of the foods that can cause red stools include /r/n/r/n Anytime you see a red color in your baby's stool, it's worth calling your healthcare provider. Ask if you can bring in a dirty diaper to have it tested. This is a simple test that your pediatrician should be able to do in their office, stool guaiac test. If there is blood in your child's stool, your pediatrician will be able to provide treatment advice. /r/n/r/n Remember also that you should always talk with your pediatrician before stopping any medication that has been prescribed to your child. /r/n/r/n Blood in a baby's stool could be caused by a benign condition such as constipation or maternal blood from breastfeeding, or something more serious like a condition called necrotizing enterocolitis, which is more common in premature babies. It is also possible that a red color in your baby's stool isn't blood but something else like a medication side effect or a red dye in something they've eaten. /r/n/r/n Call your child's healthcare provider if you notice a red color in their stool. Your child's pediatrician can test it for the presence of blood and treat the condition if required. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.